Good afternoon. Welcome to Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center, and I have Dr. Isaias Irgau with me. Although he's not with me here in the United States, he's in Canada, but we still we are very committed to these events. So he was nice enough to be with us. Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's my pleasure to be at Bariatric Friday, one of my favorite highlights of the week. So I did not want to miss it, of course. Very, very happy to be back on another great session.
Thank you, Dr. Irgau. As we discuss different topics every week or every other week, and we have some patients who are still going through the process, which I'm going to report back from them in the next couple of weeks. What we do here at Bariatric Friday in this channel, we are the voice of patients who are going through bariatric surgery, and also advocate for people who are dealing with morbid obesity. As you guys would recall from our last event, the social stigma is a really big part of what we are dealing with. Other than treating a disease, we have to also work around the issues with social stigma of morbid obesity. And this is why we really have to just be available and then make our podcast reach out to everyone. So then if we are able to change a couple people's opinion on morbid obesity, that's still better than nothing. But I think we do more than that. We do more than that because this is also is the biggest bariatric program in the state of Delaware, and because we have the best expertise from the surgical side, from the nursing side, and from the administrative side. So we want to make sure that we can reach out to more patients and help more patients. Today we are going to discuss intermittent fasting. Now, when we talk about different topics of bariatric surgery, this intermittent fasting will be one of them that will come to mind. But as we work with our patients going through the process of the surgery, then there are different things that we have to do, because we have patients who may be starting with a much higher BMI. So our goal would be to bring them down to the ideal level for the surgery. Or we may be we still want them to lose weight during the process until the surgery, even if they are not really high on BMI, just because it's healthier to do that anyway. So, Dr. Irgau, I know you are maybe one of the first people who, one of the first surgeons who actually start utilizing the intermittent fasting. So if you can give us a background on this, and then I have a couple questions after that.
Of course, Kemal, I will be very happy to talk about the concept of intermittent fasting and its place in general when it comes to healthy eating habits, but also possibly its place among bariatric patients. But before I do that, I want to kind of touch on another important topic that you presented, and that is having the expertise in bariatric surgery, right? Bariatric surgery is the most effective treatment that we currently have for morbid obesity. Morbid obesity defined as obesity that has gone extreme, right? A person who is carrying at least 100 pounds or more of excess weight beyond their healthy weight. That's the definition. And unfortunately, that's becoming a very, very common picture in our society as the obesity epidemic continues to expand. And until, not too long ago, patients were left really to their own devices to deal with this, and bariatric surgery was secluded as an area of surgery that was not really very popular among physicians, and also fairly unknown and feared by patients. And the resurgence of bariatric surgery as a very effective form of treatment is due to the fact that bariatric surgeons themselves have become really very good at elevating the quality of bariatric surgery and performing complex bariatric procedures through very small incisions. And very often, like in our program, bariatric surgery has also become a procedure in many cases that can be performed as an outpatient procedure. The safety level of bariatric surgery is comparable to things like gallbladder surgery or hysterectomy or joint replacement surgery, which is really a completely different picture to what it used to be even about 15 to 20 years ago. And as you know, CHRIAS is a practice that has been performing bariatric surgery for almost, over 20 years now. We just celebrated our 20th anniversary not too long ago. And we are surgeons who have a lot of experience in bariatric surgery. We are by far the most experienced group in our area. And as you know, through our history, we have actually established centers of excellence in bariatric surgery in many health services in our area, including major health services like Christiana Care, St. Francis Hospital, and Bay Health. And our most recent accomplishment is obviously to establish an outpatient bariatric surgery center, which is one of the very few in the country that has been credentialed as a center of excellence for bariatric surgery.
We completed over 400 cases in 2022 in the outpatient setting. And out of those 404 patients, Dr. Only 2 patients, I believe, had to stay overnight, and then they didn't have any. The one had maybe oxygen problem, and the other one had a transportation problem.
Yeah. So absolutely. So when it comes to experience in bariatric surgery, there is no question that CHRIAS has the experience and the credentials really to take care of bariatric patients at the highest levels of quality. One issue that obviously comes very often in our discussions is what is the place of bariatric surgery in the treatment of morbid obesity. Of course, it's the most effective treatment we have, but it is critically important that we educate our patients that bariatric surgery is also a tool, right? A very powerful tool, but nevertheless a tool, which means also patients' attitude towards eating, towards physical activity has to fundamentally change as well for them to be successful, not only for a limited period of time after bariatric surgery, but forever. We want obesity to become history in the life of the patient, a history that's not going to come back, and for them to stay healthy for the rest of their life. And for that to happen, we have to empower them with knowledge, understanding of different ways of staying healthy. And intermittent fasting is one of those tools, particularly, as you said. I have been pretty much an advocate of it for a number of years now. So what is the concept of intermittent fasting? Actually, if you really take it to its foundation, to its first principles, Kemal, intermittent fasting is just saying to people that there is a time for eating and there is a time for not eating, right? Right now, culturally in our society, we do not have that kind of definition. Right? We are open to business any time of the day, as long as we are awake when it comes to
24/7.
24/7, 24/7, right? And yet we now know fairly clearly that our digestive system has not evolved to be open for business 24/7, really. So by us eating without any defined breaks throughout that 24 hours, we're actually harming ourselves. So it turns out that part of the reason we have excess weight is because we have this attitude towards food, which, as long as it's available, we eat it. So in fact, there is very little connection often between hunger and eating in many cases, right? We just eat because food is available, because we have company, because we've been offered food, or because we're bored, because we're stressed, because it is there, right? So that situation has to fundamentally change. We have to say, just as there is time to do certain things in our life, there should be time for us to eat and time for our digestive system to have a break as well. So at its most basic and simple level, that's what intermittent fasting is telling us, right?
So absolutely, and you actually introduced me to this almost 2 years ago.
Mm-hmm.
If you recall that time, you asked me to watch this video, and I'm like, of course, if it comes from you, I can say I won't watch it, or I cannot fake it. So I'm like, I watch it, and then we started actually having more discussions, and we included this in our Bariatric Friday episodes. Now, originally, the idea was this was going to actually prevent aging.
Yes, absolutely.
And
Absolutely.
then while they were focusing on the aging, then they find out that actually this actually works out for the weight loss at the same time. Now,
Yep.
The fasting is pretty common in many of the religions
Yes.
as well. And now looking back, we do this as part of our diet, but then, in the old days, I remember I used to fast with the family for an entire month. And the idea was that you wouldn't eat during the daytime. And they still do it. I think they think I may be still doing it anyway, but but I do this, which the idea of cleansing almost, right? So then we are able to kind of just get to a different discipline. Now, it was working for aging is because, I think many people didn't understand that our body is like one big machine. So this is when people don't understand. They think that each organ is just independent and then they are doing whatever they are supposed to be doing. But even if I eat just like one apple or just a small piece of chocolate, the body is doing the entire thing that it would do for a big meal. And the aging kind of makes sense from that standpoint. So because if you are actually making this entire system work for a small piece of food versus if you can eliminate those and then just kind of focus on like 4, 5, 6 hour range, and then the rest of the time your body is doing resting. While it's helping aging, it's also helping the weight loss. So now one of the things that I read, this is also actually helping for those patients with diabetes.
Yes.
You may remember one of the first things that I asked, if people, if they are suffering from diabetes, can they do this?
Yes.
Is it like risky for them because the long time that they are not eating? The idea actually is there's a different program that they can utilize and then get through this whole thing with once they are at full speed, I guess, at some point, because they are going to lose weight, therefore diabetes will be done. So different utilizations are happening, but how are the patients taking this when you ask them? So they come to you and they want to do surgery and they are kind of focusing on the surgery. And now we ask them to do this diet, this fasting. How do they react to this?
Actually, surprisingly, a lot of patients are very receptive to this because remember, there isn't only one regimen for intermittent fasting. There are a variety of regimens, right? And all of them are based on the fact that we will have an eating window and then we will have a fasting period during that 24-hour time of a day, right? So a day is limited. It's 24 hours. Once that day is over, the cycle starts again. And the question is, do we assign a certain number of hours in our waking hours in which we decide not to have any calorie intake? I think that discipline itself is very, very important because we do not have that discipline in our daily life when we look at our culture, when we look on how we live. If I have to take you back, for instance, to before I started doing intermittent fasting myself, as a surgeon, Kemal, I would be fasting completely on 2 occasions, right? One is when I'm asleep, right? When I'm asleep, I'm not eating. And 2 is when I'm performing surgery. When I'm performing surgery, obviously, I have a mask on. I'm in a sterile environment where there is no availability for food, and I'm focused on my surgery, right? As soon as I finish my surgery and I've done my documentation, what I do, Kemal, is I would go to the break room. And what is in the break room? Snacks, coffee, tea, right? And then you just sit there, and it is so habitual to just grab on whatever snacks they have. They used to have this peanut butter and jam snacks, particularly in the hospital, with a cracker that, you know, you would just get there. As soon as you grab your coffee, you would grab that as well, and you would just eat that, right? And then there is lunch. You sit and you eat your lunch. And then you have another procedure. You come back, there is a break, and you do the same. And then maybe you go to the office. Your office, you're sitting down, and in the checking in area, or in the office of the manager, or in the office of the other admin people, there would be different type of snacks, and you don't even think about it, Kemal. You just take one, and then you go and you take one. So what is happening essentially is
I do it every day,
yeah,
because
absolutely.
And Anna, don't listen to me. There's a chocolate tree here in front of, in the hallway. So now, not only I have to, you know, fight myself, I have to fight them to remove that, and they don't. They so that they're hearing me right now, so I know that they're probably smiling or laughing, but like, it's difficult to say no to that. Like, it's one of the best chocolates. Like, and you see it, it's like a tree shape, so you can just pick up whatever you want, how many you want. Luckily, we have cameras, so I don't do more than 2. So, but we do it, and then that ruins my diet.
Yes, absolutely. But also remember, you know, culturally also, one of the ways to relate to people is to accept the offers for food from people, right? People offer you something and you accept it. That really strengthens your relationship, right? And as a society, we do that. So that availability of food and that intake of food on a continuous basis does have consequences. And of course, the most obvious consequence, Kemal, is that there is ongoing intake of calories. And once the body has used the calories that it needs for energy expenditure, what is it going to do with the excess calorie? The body is trained to just store that excess calorie. And what does it store it as? As fat. But there is another very important side that, you know, when we look at it from a medical point, is very, very important. And that is, every time we are taking some type of calorie, Kemal, what we do is we increase the insulin level in our blood, right? That's what we do. Insulin reacts immediately by spiking. It's produced by the pancreas and enters our bloodstream. When insulin gets up in our blood level, what is the job of insulin? Well, the job of insulin really is to open up, particularly fat cells, to take on the energy and transform it into fat. And on the other hand, what the insulin does is it prevents the fat cells from releasing fat, right? Because it's saying we have enough energy in the bloodstream. So insulin really is a weight-gaining hormone, right? And every time we are taking something in our mouths, we are getting the insulin to go up, and we are increasing our chances of gaining more weight. Right. So very often,
so if you don't mind me asking,
yeah, of course.
I just want to, because we assume that everyone understands everything that we say, and this is the way that insulin actually, the role of insulin in our body is, it's like very simple, straightforward when you are explaining, but then when you are not there, it's not that simple anymore. So when you say it, and then we follow everything that you say, but just so that I just want to break that down. So when the food intake is bringing the insulin level up,
yeah,
right? So we eat, insulin goes up. Yep. So then the 2 responsibilities of insulin, one is the open up the fat cells for storage.
Yep.
Another one is to prevent the fat cells to release energy, right? Yes. So that actually is a kind of like a really simple, straightforward, maybe picture of why certain people, us, dealing with this weight issue, because it's pretty simple. So when you are when you are storing at the same time, you are preventing for things to go out. The storage gets bigger and bigger and bigger, and then your storage space is limited. So what's happening is you are expanding. So that's how we are gaining weight.
That is absolutely it. That is, in simple terms, that's exactly what is happening. And what we are saying with intermittent fasting is we want to interrupt that process so that the insulin level stays low a longer period of time. So if there is no insulin spiking, what will happen is fat cells will release fat, right? Which means that they will be able to use fat. And importantly, they are not going to be intaking more energy and transform it into fat. So that accumulation of storage is going to be interrupted. The longer the fasting period, the more time there is for this process to happen and for us to release that fat, right? But there is another.
But I want to just insert something there. So I know and are listening. So I do want to take advantage of this and increase our office communication. So the idea of intermittent fasting, like since we started doing this, on and off we do it. So and I know you are paying attention to this. This is really important. This part is really important. So last meal that I had was last night, dinner around 8-ish. Then I had some fruit before I went to bed.
Mm-hmm.
Maybe like the last food intake was around 10.
Mm-hmm.
So I was able to manage the night through with no food. Didn't eat anything. I had coffee in the morning. Half of it was done by Joshua, and then half was done by me. And then I didn't have anything, and it's almost 4 p.m. So I ordered food later on, since we don't have our meeting today. So I'm going to eat something around like 4:30. However, there is a trap here outside of my office. chocolate tower.
Good word.
So, and every day I fail to, do what I'm supposed to be doing, because like I'm coming out of that almost 16 hours, just food. No food with some water intake, and like you are weak, and then when you see the chocolate tower, you go after. And then they're like, "Oh, you see, he got it again." So there's no teamwork here, so that needs to change as part of this diet, right? So because it's a difficult one to do. The reason I'm saying is because if everyone else is eating everything in front of you and you are hungry for 16 hours. Now, one thing that I have to tell you, Dr. Irgau, there is, I don't know if I shared this one because we had covered this in different episodes, like with the same topic. There was a study that's done when we are hungry, when we have no food, our brain works better. Because there's some desperation apparently, so then we become more creative. Now, I'll let you read the research study that came out, and then you tell us if we want to get into that in more detail. But it kind of also makes sense because every time we eat, the first thing that happens is we are tired, we are sleepy, and we are not comfortable. Like eating part is all good, but then as soon as you eat and finish, okay, so I'm gonna take a nap. So right, this is happening. So, but I think the way that we utilize intermittent diet for our patients, that also probably gives them not just that initial perhaps weight loss, but also getting through that new discipline that they need to be on. This is a good way to test what they are capable of doing, right?
Yes. We talk about stimulus avoidance, Kemal, right? When you say to yourself, right, I mean, you explained it so well in your situation, what you have to do what you are, because clearly, with your job, particularly Kemal, you are in a worse situation when it comes to really having to eat because you're dealing with people continuously, right? There is a lot of people around you. There is a lot of food. So it is harder, right? But once you say to yourself, okay, the last time I've eaten is last night, right? The next time I'm going to be eating is going to be after 4 p.m. That gives you such a long window, right? But by setting that discipline, you are not bothered by the stimuli, right? Whether it's chocolate, whether it's cheese, there is no issue about, oh, shall I eat this? Or shall I have a protein shake? Or shall I have that, right? You said, I am going to have neither until this hour. And that's the whole point about the power of intermittent fasting, Kemal. And again, we're not saying here that people should do the OMAD, one meal a day type of thing. We're not saying you have to do the 18-hour, 6 type of interval. Whatever interval you choose, just stick to it, so that it's going to be a period of rest in your day in which you will be avoiding that stimuli. That's the key issue that's coming up. Okay, now I want to take on a couple of things that you mentioned, Kemal. First of all, let me go back to this issue about our brain being more focused, right? This is important, right? And there are two reasons for why this is happening. The first one, Kemal, is that from an evolutionary point of view, we evolved to survive hunger, right? Mm-hmm. All our body is a machinery that was built to be able to seek food at times in which food is not available, right? Which means your brain has to be at its best when you're hungry, right? So you are more alert, right? More focused, more analytic in your capability, right? But the other thing also that is very interesting, Kemal, is that when we digest food, we expend a lot of calories. In fact, digesting food is one of the most energy-consuming processes, right? So if you're doing that, your brain is not going to get as much energy. So that's why you feel so sluggish, because a lot of your energy is going into processing all that food that you've eaten, right? So not eating, fasting, will give your brain much more availability of energy, right? Because it will get all the attention it needs in terms of getting that food. It's not competing with your digestive system for that energy. That's why alertness is so common. So it is not unusual for people who start doing intermittent fasting and then say, hey, I am less tired. I am much more alert. I am more focused. I am more imaginative. I am more creative, because the brain is working in an optimal level, right? So that is a very important point. The other point I want to touch before I forget, Kemal, is what you said about diabetes. Clearly, people who have diabetes, people who have high blood pressure, people who have to take medications that require food intake, all those are situations in which intermittent fasting, particularly the more serious type of intermittent fasting, has to be undertaken under a physician supervision, right? And of course, I am thinking about, and obviously we're not including people who have normal weight. They may not need to do that to the extent that we are advocating it. Or obviously situations like pregnancy will require a different attitude as well. What we're talking about is people who don't have those conditions, but who are struggling with weight, right? And those are situations where intermittent fasting as a practice, not as a diet for a week, for 2 weeks, but as a practice, as a lifestyle, has huge, huge advantages in a society where we are overwhelmed by the continuous presence of food around us, right? Intermittent fasting will give us that discipline, would give us that defense, right? Because we'll say, well, this is not my time to eat, so whatever is around me, I'm not going to eat it. And it's surprising how well people adapt to this, Kemal. And I do particularly like it, obviously, on my post-bariatric patients, because, there is no fear that they will overeat in their eating window because they have a small stomach that cannot contain more. In fact, if you look at it, Kemal, the reason patients struggle with weight regain or with inadequate weight loss after bariatric surgery is not because they are eating massive meals. They cannot do that. Their stomach is too small. It is because they are doing what's called grazing, right? And grazing, Kemal, is the opposite of intermittent fasting, right? Because you're eating continuously during waking hours, you're snacking continuously. And it is that grazing, it is that snacking that traps us, because we are in a society which is perfectly set up for grazing, right? Because there is grass everywhere, right? So we're grazing all the time. In this society, a perfect defense would be intermittent fasting, where you have limited hours in which you allow yourself to eat and other hours in which you are just drinking water or water-like drinks that have no calories.
So just so that I can add one thing about this physician supervision for those patients with diabetes, so that there's no misunderstanding. There's a specialty called bariatrician. We have one in our team, Dr. Van is saying,
Yep.
These are not surgeons. These are either family or internal medicine providers, physicians who have a board certification on medical weight loss.
Yep.
We definitely want them to work with a bariatrician if they're going to choose to do anything other than what they were already given by their primary care physician. So we are not actually advising them to start this without talking to the proper resources. Now, I think the discipline, Dr. Erkan, it all comes down to the discipline. And this is true for almost everything. If you want to get better, so we need to have, like, discipline it's interesting enough that discipline is kind of used in a negative way. Because in like school and in work, like, you are going to be disciplined if you don't do X, Y, Z. I take that, my approach on discipline is different. I think discipline is a strength. So if you are able to do certain things on a certain schedule, that makes us stronger. So, our case conferences daily at the same time, every day, Monday through Friday, that's a discipline.
Yep.
So the being able to work out on a certain frequency is a discipline. If you play tennis, practicing your game, that's a discipline. So these are all, discipline is a good thing. Discipline is not a bad thing. So, and I think this fasting probably supports our patients the most because they are dealing with a lot of issues with eating habits and when we eat, how we eat. And I think this is a good way to kind of channel this through and then help them to get to the surgery. And even after the surgery, they can actually follow these diets. So anything we missed, I think.
Well, no, I think we mentioned everything. You did mention the issue about the slowing down of aging. We know with intermittent fasting, which is a very, very really interesting and very very appealing, area of research right now, because in animals, it has been shown without any doubt that animals who practice or who are made to practice intermittent fasting actually live a lot longer than animals who are allowed to eat normally. And from a theoretical point of view, actually, it makes a lot of sense. As we mentioned earlier on, for instance, if you're eating all the time and turning on your digestive machinery, you're really aging yourself, right? You're working your body to death really by doing that continuously. Yeah, absolutely. But another area which is really, really appealing is the knowledge that when cells are not occupied in processing new incoming energy, which is when I'm not really worried about working to process the food that you're providing, actually do a lot more what's called housekeeping duties, right? And housekeeping duties within the cell means getting rid of old proteins, for instance, right? Mm-hmm. And getting rid of all those proteins actually decreases the chances of those cells becoming cancerous, right? And cancer is one of the leading causes of mortality, right? So maybe by doing intermittent fasting, we can decrease our risk of many types of cancers as well. It's obviously an area of research that it has vast promise, and a lot of research is being done in this way. But intuitively, Kemal, it makes a lot of sense when you think about it.
It does. It does. And right now, it's almost like a default, like a maybe kind of like some adjusted way of this. I do it Monday through Friday. And it's doable, it's manageable. We just need, a little bit better support from our friends and families. So if they do that, then we should be good. Dr. Erkan, thank you so much again. So we are going to be, we're going to continue to be the voice of patients who are suffering from morbid obesity.
Absolutely.
Patients who are going through the bariatric surgery, regardless of which program they go to, as long as they get the help, this is the most effective, most efficient way to deal with the problem, with the disease. This is the best treatment method, and we want to make sure that more people are educated and more people take advantage of this. Well, thank you for being with us, and we'll see you guys next week.
Thank
Bye-bye.
you. Thank you. Bye-bye.